In July of 2022, Walpole entered an intermunicipal agreement under the State Action for Public Health Excellence Grant in collaboration with 7 other Norfolk County communities. Awarded to the town in 2021 by the Massachusetts Department of Public Health and the Office of Local and Regional Health, the grant aims to help communities expand the sharing of staff and resources to improve the effectiveness and efficiency of the distribution of health resources. Hi, I'm Jessica with Walpole Media, and today we're joined by Director of Public Health Melissa Ranieri to discuss the Public Health Excellence Grant and what it means for Walpole. Can you describe the State Action for Public Health Excellence Grant and how it's designed to help communities?
Sure, so the Public Health Excellence Grant is designed to expand on services that are currently provided by local health departments by potentially utilizing services and sharing services amongst local health departments. In this case, we were on board with, it's 8 communities in total with Walpole, and that's how we originally applied for this service, or this grant rather.
What process did the town go through to secure this grant funding, and how did that process begin?
The process was a collaboration with what's called NC8, so Norfolk County 8. So Walpole with 7 other communities started this. So this is a group that's been together for many, many years, gearing towards the Public Health Excellence Grant. This is something that we started back in 2020. There was a capacity assessment done with NC8 that told us that there was an option for having these shared services, and the capacity assessment, or assessment rather, explain that by providing these public health excellence grants, we could delve a little deeper and provide services to our residents.
How are the funds being used in Walpole and the other municipalities involved?
Sure, so right now, again, it's a collaboration with the 8 other communities, or Walpole being one, so 7 other communities. So we have been able to hire some staff, including an epidemiologist, a community resource specialist, as well as 2 other employees. So right now, those employees are helping out with the epidemiologist. They've helped out doing COVID-19 dashboards. They're able to pull data from each community as needed. So each community of the 8 communities might have different needs, and therefore, they're very accommodating if there's something that we want run, whether it's, tick-borne illnesses, different vaccination rates. They're able to run that and provide data on that. Our community resource specialist is helping out with finding potentially flaws or lapses in services within the communities, which again might differ from community to community. If there's an issue with maybe hunger issues, things like that, few food insecurities, where we can provide resources that we might not have. And then 2 of the other employees that are employed by the grant are helping out with inspectional services as necessary.
What metrics is the health department using to determine the effectiveness of these measures?
Sure, so ultimately the Public Health Excellence Grant is kind of like a stepping stone to the big, great picture. So right now in the state of Massachusetts, we're doing what's called a community capacity assessment, which is for the 351 communities in the Commonwealth. And what it is it's showing potentially what staffing is in each community and what services are provided in each community. So by having the Public Health Excellence Grant, we can kind of delve a little deeper to see what services we are offering and what we're missing, and then ultimately we're kind of working towards what's called the Public Health Blueprint for the state, and then that way everything will be measured in that capacity to see where we're missing or where we need to bulk up on it, and then potentially from there funding from the state would trickle down. Some things are good to do with shared services. If you have potentially a food truck that's entering 8 or 9, 10 communities, rather than that truck being inspected by each town, potentially that would be a good way to utilize a shared service. And then ultimately we would gauge it to see, what the outcome is and, what's beneficial and what potentially isn't.
Why is this form of intermunicipal collaboration important for communities like Walpole?
So we love working with other communities. We find that with that cross jurisdiction, it helps because there's certain things that maybe we're not doing that potentially we could learn from and grow and pick up on that, and vice versa. We work closely with our neighboring communities, so potentially if there's an issue that we need more workforce or more individuals on deck, they're always willing to help. So it's great to get information on how other communities are doing things, and also potentially lend a helping hand when needed as well.
Are there any plans currently in place for any additional or remaining grant funds?
Sure. So we do continue to work with the Norfolk County 8, which again, so Norfolk County 8 is comprised of, it's Canton, Dedham, Milton, Needham, Norwood, Walpole, Wellesley, and Westwood. So we've been working with this group since Walpole was the last one to join the group, but since about 2016, Walpole was joining. So we have worked with them on different grants, whether it's standardization of food. So I definitely anticipate us like looking and applying for additional grants. There's different grant cycles, so potentially once this grant's over, we're always looking and actively searching for additional grants to potentially fund staff members that we have through the NC8 Coalition.